My name is Dr. Srinivas Bacchu. I am a consultant hematologist and bone marrow transplant specialist at American Oncology Institute, Hyderabad. Today, we are going to talk about a few of the common questions which a patient asks when they walk into my clinic. So, what are blood disorders? Like all organs in the body, like the heart, lungs, kidneys, so is also blood, an organ in the body. And problems can affect blood as well. These can be simple problems such as anemia, or it can be complex problems such as blood cancers. So, blood is a very important organ in the body. It has many functions. It carries oxygen around from the lungs to different parts of the body. It also helps us fight infections, commonly bacterial infections, which are quite common. Blood has many important functions in the body. It carries oxygen around in the body from the lungs. It also helps us to fight infections. And when we have any cut or a bruise, it helps us to stop bleeding. Blood problems can be simple, such as anemia, or it can be complex, such as blood cancers. There are mainly three different types of blood cancers: leukemia, lymphoma, and myeloma. Today we will try and understand these disorders in detail. What is leukemia? Leukemia is a blood cancer. The stem cells, or the mother cells, instead of producing maturing cells such as the red cells, white cells, and platelets, produce only monotonous population of cells. Because there is lack of these mature cells, then the person who is suffering from leukemia, his symptoms develop such as tiredness, inability to fight infections, and bleeding. The red cells carry oxygen around. The white cells fight infection, and platelets stop us from bleeding. As these cells are very less in leukemia, these patients have bleeding tendency and suffer from infection. Anybody can get leukemia. When our normal immune system is around and working properly, when there is abnormality in these cancerous cells, it is recognized quite early and these cells are killed. But if your immune system is not that great for some reason and the leukemic cell escapes this immunological process, then the cancer develops. That's a simple way of explaining why somebody can develop blood cancer. Leukemia can be acute leukemias or chronic leukemias. When we talk about acute leukemias, we are talking about leukemia or cancer developing in days or weeks. When we talk about chronic leukemia, we are talking about leukemia which develops months or years. This is a simple way of explaining what leukemia is. If you feel unnecessarily tired or have repeated infections or bruise or bleed easily, you need to have a blood count check done to see if you got any abnormalities. What are lymphomas? Lymphomas are cancers of the lymph gland. These lymph glands are everywhere in our body. They form an important protection against infections seeping into the body. You might have commonly encountered tonsillitis. Tonsils are nothing but lymph glands. When they encounter any infection, they are swollen. If for no reason the lymph glands get enlarged, then you should suspect cancer. In India, the commonest cause of lymph gland enlargement is infections such as tuberculosis. But also, we should keep in mind that it can be secondary to cancer as well. People with lymphomas develop fever, sweats, and lose weight. When they examine their body, they can feel a lump. If you feel a lump, then this needs to be investigated by a doctor with the help of a biopsy. What is myeloma? Myeloma is a blood cancer. This is a cancer of plasma cells, which is a type of white cells. Patients with myeloma can have anemia, can suffer from kidney failure or can have a fractured bone. Most commonly, they may suffer from back pain. People who are elderly, when we say elderly, people who are aged more than 60 years are more likely at risk of myeloma. In India, sometimes we see young myelomas as well. Whether this is a true increase in incidence of myeloma in the younger people or just because of the population size we are seeing many young myelomas, we don't know. Unless we have statistical data. I am going everywhere. What are the symptoms of myeloma? If you feel tired, lethargic, and if you have bone pains, which is back pain or any bones causing pain, then myeloma is one of the reasons. You should consult your doctor, get a CBP done, and check for protein levels in the blood. They may also do special tests such as X-rays to look at the bones in detail. For all cancers, we investigate them by a bone marrow test, wherein a small sample of bone marrow is taken from the hip bones commonly, and sometimes from the sternum if the hip bone is not easily accessible. If your doctor strongly suspect cancers, then they'll advise you for a bone marrow test. I would recommend that if you suspect that somebody has a blood cancer, the first thing they need to do is consult a hematologist nearby. Who gets these blood cancers? You may be asking yourself. Most of the time, we don't know the cause for blood cancers, as I have explained earlier. But people who smoke, people who get exposed to radiation or pesticides are at increased risk, are thought to be at increased risk of blood cancer. What are the treatment options for somebody with blood cancers? All acute leukemias need to be admitted into hospital for intense chemotherapy. Some of them may be cured by chemotherapy alone, while others may require a bone marrow transplantation. Chronic leukemias can be managed most of the times as outpatients. They may just be monitored. Chronic leukemias can be managed as outpatients. Some of the patients may be on chemotherapy, others may be monitored alone. It depends on what type of chronic leukemia you have. People ask me, what about the side effects of having chemotherapy? Yes, any drug can cause side effects. The common side effects of having chemotherapy are nausea, vomiting, blood counts getting low, needing blood transfusion, platelet transfusion, and it increases risk of infection. For nausea and vomiting, we have very good medications. These medications will make a difference, and most of them suffer from mild nausea and vomiting as such. We have injections such as growth hormones which decrease period of neutropenia. We have blood products now which are better than before, such as packed red cells, and we have blood products which are better than before, such as leukodepleted red cells and single donor platelets, which decrease chances of infection from donor to the patient. You may experience less common side effects, but all of these are manageable. You just need to speak to your doctor and take the best advice. People commonly ask about diet. What diet they should have taken to prevent cancer? What diet they should have when having chemotherapy and when the blood counts are low, called neutropenia. Eating healthily is one of the options to prevent cancer. There is no correlation between certain food substances and risk of blood cancers. I tell my patients that they should normally go for a healthy diet and nothing specific. But for patients who develop cancer and who are on treatment with chemotherapy and for whom the blood counts are low called neutropenia, I tell them that they should follow a neutropenic diet. The general principle of a neutropenic diet is that it is well cooked, well preserved, and ready to eat. There is less risk of bacterial contamination, and they should also drink bottled or filtered water. As many people survive cancer nowadays, the important question they ask about is long-term side effects of having chemotherapy or bone marrow transplant or radiation. Each of these treatments has side effects. Some may have an effect on the heart, some may have an effect on the growth, some may also affect your fertility. It is important you discuss this with your doctor before you have treatment. Internet is quite an important source of getting all this information. You need to speak to your doctor to find out where you can get the best information. As you can see, Macmillan UK Cancer Support web page has very important informations. One of the important website which I always ask my patients to visit is Macmillan web page UK. We'll just display you the web page address so that you can go on to it if you require.